Dr. Rosalyn Georg, board-certified dermatologist and owner of Wilmington Dermatology Center in Wilmington, North Carolina. I'm also a national trainer for Allergan. Today we're going to talk about Kybella, and Kybella was FDA approved in 2015, and we were fortunate enough to be one of the first practices to be trained in the nation to perform the procedure. And it's really been a game changer. We have spent a lot of time focusing on the face, but a lot of people were very concerned about their neck, and particularly the submental fullness or the dreaded double chin. So everybody was looking really good, and they still had this little tiny bit of fullness underneath the chin that we weren't able to address. And that's what Kybella does. So Kybella is deoxycholic acid. It's a synthetic version of the same substance that your gallbladder makes to digest fat. And what we're able to do is kind of mark a treatment area. It's generally just this area above a little bone here to right underneath your chin, and then kind of where your frown lines, your marionette lines would be down. And so this is really the treatment area that we're going to focus on. And what we know is that once you get that angle right, it really defines the jawline. It makes people look thinner, it makes them look more structured, and it's a great treatment for men and women. I have to say this is a very popular treatment with men because it's been really non-invasive, very little downtime, and the results are very good. And so once we know that we have an area, and how we tell is we kind of pinch. So if it's more skin, that's more ulthera. So if you have skin loosening, you want to have a tightening device. If you actually have fat underneath the chin, then you want to destroy the fat. And frequently we're doing these procedures together to get the best results. But sometimes there are one or the other. So that's the difference between the two procedures. Once we have the treatment area marked, we put this little temporary tattoo on, and that just directs where we're going to inject the product. So once the product is injected, you get some swelling, you feel a little bit of burning and tenderness, and then it takes a few days of swelling. So there is some downtime with the procedure. Generally, I tell patients you're going to have this done on a Thursday and go back to work on a Monday. It does require multiple treatments. I would say most people need at least 2. Some people need 3 or 4, but it is permanent. This fat is completely gone and it doesn't come back. So it's nice. So yes, you are spending money, but you're spending money on something that's permanent that you're not going to have done again. I personally like to space the treatments at about 2 months. In the studies, they did it every 4 weeks, but there is still a little bit of tenderness sometimes and a couple of little lumps or bumps underneath the skin, which means the product is still working. So I like to have all of the fat cells destroyed before I'm going to inject the next round. But most people really do need sometimes 3 to 4 treatments, depending on the goals and how much they have. Some people just want a little bit and then they'll do 2, and some people really want all of it gone so they have that nice defined jawline, so they're more on the 3 to 4 side. There is minimal discomfort with the procedure. We actually do inject a little bit of lidocaine before we do the procedure, and that makes it much more comfortable for the patient. I recommend them taking ibuprofen after the procedure and icing that day. The next day they are pretty swollen, so I tell people to avoid social activities. Again, have it done on a Thursday, go back to work on a Monday. But it's really been a nice adjunct to our practice to really provide people with full facial rejuvenation, which is now the trend. We don't fix one thing, we're trying to really comprehensively make people look their best.